So, reproductive system in males, it has several components, right? Apart from the external parts, what we're seeing, we can all the inside parts what are important for the reproductive male system. It's our abdomen, pelvis, and perineum, right? So, and the major components for the male anatomy is like the testes, epididymis, duct afferents, ejaculator ducts. We're having double of them on each side, and also urethra and penis. Regarding the urethra, I won't speak anymore because we already spoke about that part, and the other parts why it is important to study really well, because we will have they are having some physiological functions that are needed for the sperm and for sperm count and etc. So we will unit that to know. So on this photo you are seeing how everything is located from inside, and you see here that we are in our pelvic girdle, right? And we're seeing here our bladder, and underneath the floor of bladder we're having our the prostatic gland, and that's also a really pathognomic location for the prostatic gland, because whenever we're having some kind of either prostatic benign hyperplasia or prostatic cancer, either why the males are going to toilet that often, because when we're having hyperplasia or cancer, this is pushing the bladder up, right? So meaning the diameter of the bladder, inside diameter, will be lowered. So meaning that people want to go more and faster in the toilet. As you see from the bladder, we're having here the urethra, right? They coming out through the penis and through the whole way. So the idea of the prostate, it is around the girdle, around the our urethra. So that's why we can have some kind of constriction. So it's a really good question regarding the surgery to write here around where the prostate is located by its function and how it is located, right? So if you see really slight colored structures, here are the seminal vesicles, and even the name implies what function it might have. We're having the seminal vesicles, and we're seeing the ampulla of vas deferens. So we're having vas deferens, and vas deferens is having the ampulla, and this is structured here. Also, as you see the seminal vesicle and vas deferens is having ejaculatory ducts. So whenever some product is created there through the ejaculated ducts, it's going straight ahead to our urethra. That's why for the semen and for the urine, we're having one opening, urethra, and everything goes there, okay? Apart from these are where the internal parts, right? Whatever major internal parts in the male reproductive system, we're also having bulboureteral glands located beneath the prostate gland. And after that, we're starting off the external parts, and it's our the penis and in our testes. And the idea here is that, as you see, testicles are not the part of our pelvical girdle, right? They are, as you see, coming from the let's say abdomen. I will be honest. They are coming from abdomen, and that's why we wrote here the reproductive part of the male compartment consists of the abdomen, pelvis, and perineum, right? Perineum, it's the same for females and males, generally. Pelvis, where everything is located, right? These parts, what internal organs, whatever is located there. And regarding the abdomen, the testicles are coming from the abdomen through the inguinal canal, and inguinal canal is really important for the surgeries and for the testicles to come down. So when a child is born, their testicles will be located on the side of, like, for example, kidneys, like up in the abdomen. And by the age as the child is rising up, the testicles are coming down. So first, like, however, like, outer structure, the skin of the testis will still be visible despite the age, but like it will be free, and after the age it is coming down. If it won't come down, that we will have some kind of like precancerous condition. I guess you already heard about the cryptorchidis, right? No. Okay, yeah. Cryptorchidis, it's like undescended testis, which is located in the abdomen, meaning that that person won't be able to have children, because like the testis, that it is located outside the body, it has its own function again. So yeah, so the operation is done, the surgery is done, the testis is coming down. Either it is cancerous or either it's precancerous, so it depends on the situation. So you got the idea. So yeah. By age of the 5, if it's even late, like 2, 3, around 5. Because after that we're like then we're having the puberty, and in the puberty we're having like the semen and spermatozoids creating their own forma, and this process won't start if it is in the stomach. Around the abdomen located, stomach it's not correct word, around the abdomen located, because like when the testes are located outside the body, like inside the body we're having different temperature, and outside of course there's a different temperature, right, due to the homeostasis. So the spermatozoids are needing like outside temperature, like not that hotness and warmness, to synthesize spermatozoids, right? So that's the difference, and that's the main part why the testis is outside the structure, outside the internal organs, right? Despite that we're counting them as an internal organ. So as we see here, we're having deep inguinal canal, and our testis with its own spermatic cord is located there, and it is hanging on the spermatic cord, and there we're having our epididymis located, and also epididymis is having some kind of, as you see, huge tail, and in this tail is again connected to our ejaculatory duct, and the fluid that it is synthesizing, like with the semen, like semen is a general fluid of like all seminal vesicles, ejaculatory ducts, that everything has collected. But what like exactly like the epididymis has created, they are taking it to the urethra, okay? And the penis, we will talk about that structure. This is outside the body, and it is the muscular tube, let's say like that. So I guess you got the idea in anatomy where what is dislocated really well, right? Okay. So despite that I mentioned all of these structures, let's go by the text, that we're having additional 3 types of structures, which are accessory glands. Apart, like the main organs are testes, epididymis, ductus deferens, ejaculatory duct on each side, so we're having 2 of them, and urethra and penis. And other structures what we're having are, let's say, accessory glands that are giving some kind of fluid to the system, that everything is working there, and this is our single prostate. You already know the information regarding the prostate. We're having a pair of seminal vesicles, and pair of bulbourethral glands. Also, if you remember, in female structures we do have bulbourethral glands also, right? Okay. Do you have any kind of questions regarding these topics? Yeah. Here. I couldn't hear. vesicles. Okay. Where you see seminal vesicles here? These ones. So, like these structures, if you see, if someone has a computer PPT open, just check there because it's better to follow. So these are like these parts are seminal vesicles, right? This is the duct of vas deferens, and as you see here, epididymis is here, taking all this stuff up there in the urethra. Okay, so I would really love to ask the questions about inguinal region, inguinal herniation, management of inguinal hernia. That would be a really nice topic to ask because, like, mostly we are having superficial and deep inguinal canals. Turn off. Okay, but some of the students that are sleepy, that's why I'm not turning off the lights. So I will switch it off and then turn it on, okay? Can you see? Okay, if someone is going to fall asleep, just tell me and I will. So this is our, like, seminal vesicles. Can you see? Yeah. And like our vas deferens, and it's having this kind of structure, so it is coming to our epididymis. This is right. Okay. Let's start with testicles. So testis, it is developed high on the posterior abdominal wall and then descends normally before the birth through the inguinal canal in the anterior abdominal wall into the scrotum of the perineum. So what's the scrotum of the perineum? So the location where our testis is like located, the skin, it's our scrotum. As you see here, so like the skin, the outer layer, what it is painted here, this is our scrotum. Yeah, and it is like the testis is located in the tunica vaginalis. It is like the special layer where it is located, and also we're having tunica albuginea where it is located also. So it doesn't locate just like under the skin straight ahead, it has like different structures, and we will talk about that. Also, we are having some kind of muscles there. Also, it is called premasteric muscles. I guess we will discuss it in a few minutes. And what they are doing, they are lifting the testis. So whenever, for example, if you move something on the male's thigh here, the testis will be lifted up, and it is like premasteric muscles. So we discussed like the scrotum and perineum. It's a part of the perineum. Sorry, that's also most important things to know. Good for the questions. So as I mentioned, the testis is descending during the birth, right? It should be descended, but still at the age of 3, if it's not descending, we're doing some kind of surgery to take from the abdomen and put it in the scrotum. So when the testis is descending, we are taking with it the vessels, lymphatics, and nerves. Okay. Also, the principal drainage ducts, like the vas deferens, with it. So if you see here, vas deferens is coming again from the deep inguinal canal, right? So whenever we want to descend our testis, we should take everything down to the inguinal canal to put it in the location, so it won't come out of blue from somewhere, right? Okay. So inside the testis, it has some kind of this location and these structures located. So what we should know here, let me see. Okay. So let's discuss what structures we see and where they are located, and then go by the text. So we already discussed like two structures are located there. In the histology you will study the cells, but I guess in physiology we will also study the histology because physiology needs more than all these types of cells, let's say. So we see that this something is like purplish stuff, and it is our tunica vaginalis, this part, right? This purplish stuff. And it has parietal layer and visceral layer. And between of them we're having the cavity. So the parietal layer, cavity, and visceral layer, right? In the visceral layer, we are having the tubules and seminiferous tubules. What's that, and what are the tubules, and what are the seminiferous tubules? And also, like, these kind of tubules are ended in our tunica albuginea, and tunica albuginea is the capsule. So what consists of the testis mostly? It is our vas deferens, epididymis, their tubules, then everything is ending in the tunica albuginea, and around the tunica albuginea we are having tunica vaginalis. Okay? So before starting like this pinkish stuff, whatever is painting there, we are having this tunica vaginalis, outer layer. Above that we're having the skin. It is parietal layer, cavity, and visceral layer. Then we're having more inside our tunica albuginea. You can say pronounce and tunica albuginea or something also. And this is our capsule. We're having another organ like this. Whatever we said, it was just like the stuff that makes it a bit harder and gives some kind of consistency, okay? We're having one organ, and this is our epididymis, and this is our like the structure of the epididymis, that it is located here. And we're having the head of the epididymis, body, and the tail. So if we will take the testis as a ball, like hanging, right, and it is hanging on the ligaments that we will say right now, as we will take it as a hanging, head is like the uppermost, like superior part, then comes like the neck, and then comes the tail, and the tail is giving us our vas deferens, right? And through the vas deferens we are going back to the deep inguinal canal and joining our urethra. So this is like, we are discussing this part, so it comes out here and joins our urethra. Okay? Is it clear? Questions? Okay, if it's clear, then we'll continue. So, in the tunica albuginea, we are having seminiferous tubules and tritubules. So this part here are our seminiferous tubules. These seminiferous tubules should somehow be connected to our epididymis, right? So they are connected through these tritubules, and you see here these tritubules, and these tritubules again are connecting to each other and giving us efferent ductals. We can say efferent ducts, and through these efferent ducts they are joining the head of our epididymis. Then the fluid, for example, is going from the head of our head of the epididymis, body, tail, and from tail they are going to the vas deferens. Okay. Questions regarding this? Nobody fall asleep. Thank you. Questions? No questions. Now I have questions to you. Which canal should testes go through to be located where it is located? Which inguinal? Superficial or deep? deep inguinal canal. Uh, so one more thing, like how it is hanging, right? As we saw here, we're having like X ligament remnant of the process vaginalis, and it is hanging through which structure? Tunica albuginea, tunica vaginalis, or striped tubules? How it's hanging? Yes. Through which structure? Someone should hold that ball, right? Who is holding it? Yes, whole testis. Tunica albuginea. Your answer, right? It's incorrect answer. Guys, you see tunica albuginea is just around this pink, light blue stuff, right? It is around the seminiferous tubules and striped tubules, right? How it can be hanging. The pinkish purplish stuff is hanging here. And if it is the remnant of the process vaginalis, so meaning the tunica vaginalis is hanging the whole ball inside. Clear? Okay. Yeah, process of the tunica vaginalis. Okay. More questions. Can someone tell me how the sperms are getting from the seminiferous tubules to the vas deferens? Like by name, you know? No, you missed something. Efferent ductals. Okay, thank you. That was the correct answer. Okay, you got the basics. Now let's understand more deep how everything is hanging there and structured, okay? Lights off. So, testes are ellipsoid-shaped structures, as you know, and is enclosed with the end of the elongated musculofacial pouch, which is continued with the anterior abdominal wall. It projects into the scrotum. What was the scrotum? Scrotum was the skin above the testis, right? So we're having a new word called spermatic cord. It's a tube-shaped connection between the pouch and the scrotum and the abdominal wall. So if you see here, what we see, what structures we see? Testis, epididymis, right? And like here, we see the spermatic cord. And in the spermatic cord, like it is like exact like round line substance, right? And in the spermatic cord, we're having which structures? It is like a ductus deferens, pampiniform plexus, testicular artery, and testicular nerve. This is like the exactly quiz question with the case report. Like we might have a case there that we're having rotation of the testes, for example. I won't ask like which disease it might be, but we can say like which structures might be involved in the rotational part. And you should know that on the spermatic cord we're having rotational of the testes. Yes, AJ. What? We don't have like testicle vein there, but we are having their vein complex. So the veins are giving some kind of plexus, and that's why it is called the different name, and the plexus is entered there. Another question might be on the quiz like that. For example, you're having rotation around the spermatic cord. What will be your treatment for this patient? We know the surgery, not taking the surgery. it's an emergency situation, what you will do. Quit on the opposite side. That's the correct answer. Okay? So yeah, see, as we see here, like the testicular artery and testicular vein is coming down and creating us a pumpiniform plexus, and this plexus is just like the vein plexus, and that it is entering through the spermatic cord, and it is the main plexus which we need to decrease the temperature of the testes to have the normal sperm. Okay. Yeah. So now exactly, can you tell me how the sperm is, the testicle is hanging out? How it's hanging? Through the spermatic cord already, we know the answer, right? So, the sides and anterior aspect of the testes are covered by a closed sac of peritoneum. It is the peritoneum, it is called like tunica vaginalis, which originally connect the abdominal cavity. Normally after testicular descent, the connection closes, leaving a fibrous remnant. So here, whenever you see like how these structures, like officially we're having these structures like when the child is born and during the child development, but these other structures are going through some kind of pack, right? They should enter, for example, the room and stay there, and they are entering through the tunica vaginalis. Okay, and that's also important for the surgery quizzes. So, judging from that, what kind of structure can be our tunica vaginalis? Yeah, what basic tissue it can be? Fibrous tissue. It's fibrous tissue, okay? Okay, do you have any kind of questions regarding the testes before we start our discussing epididymis? Yes. Yes. Okay, yeah, I got the question. So let's go back to this photo. So see, like we are having tunica vaginalis, and at some point it is ending there, and that's it. But during the embryology, it will give us like our inguinal canal. But after that, it is like remnant. It gives us, it's kind of closed, you know. It looks like this, and here, the upper part. No, it covers the whole testicle. In this photo, it's not painted that it is covering like it's one side, but it is covered officially full one. But it's not going upward, up here. At some point, like it was going upward, where while we had like the testis coming down to its original location, it was open. But after that, it is closed. It is closed. Okay, more questions? No questions? Okay. Epididymis. So epididymis is a single long coiled ductal structure located on the posterior lateral side of the testis, and it has two different components. One of them it is like efferent ducts, and another is like the true epididymis. The efferent ductals, which are the coiled masses located on the posterior superior pole of the testis and forms the head of the epididymis. But to see the photo here, you see our like efferent ductals that are creating the coiled structure called head, and on the other way it is attaching to another structure. Okay. Like these efferent ductals are creating the structure called redhead testis, like this one. and then we're having the stride tubules, and then we're having seminiferous tubules. So we added new structure there, retatestis. Okay? Uno momento for realization. Are you sure you got that? Yeah, see, like we're having the head of the epididymis that was created from the efferent ductals. This is that side, right? Now that side. Here, we created like the bunch of, like the crossing of our stride tubules, but before they became stride tubules, we are having the retatestis. It is like the crossing lines, and then at some point they became like strides, and they created like stride tubules that entered and created like seminiferous tubules. Okay? The whole complications. So efferent ductals, they are creating head of epididymis, right? So we are having true epididymis, which is a single long-haul duct, and two which the efferent ductals all drain, and which continues inferiorly along the posterior lateral margin of the testis and the body of epididymis, and enlarge to form the tail of the epididymis as the inferior pole of the testis. So, what you got from this sentence? You got that whatever is here, this is all the true epididymis, right? There. So during the passage through the epididymis, spermatozoa acquires the ability to move and fertilize the egg, right? The epididymis also stores some spermatozoa until ejaculation. The end of the epididymis is continuous with the ductus deferens. So here and then here, right? Going up the tubules. Questions regarding this? No? Okay. So now let's talk about the ductus deferens, or the vas deferens. So ductus deferens is a long muscular tube that transports spermatozoa from the tail of the epididymis into the scrotum to ejaculatory duct into the pelvic cavity. It ascends from the scrotum as a component of the spermatic cord and passes through the inguinal canal into the anterior abdomen. So which structures are passing through the inguinal canal? Yeah, yet we know just one this. Vas deferens. That's the correct answer. Like we already seen this photo. After passing through the deep inguinal ring, the ductus deferens bends medially around the lateral side of the inferior epigastric artery, which will be like the inferior epigastric artery. This one. So as you see, it bends over the inferior epigastric artery and crosses the external iliac artery and then external iliac vein at the pelvic intel to enter the pelvic cavity. There might be a question on the quiz. We are doing some kind of surgery, like vascular surgery, and somehow we are doing that surgery on our external iliac artery, and the patient is having no children at all afterwards, despite that despite that every other structure is working. What structure was obstructed? Why? Yeah, it is crossing the inferior epigastric artery, but it is located over the external iliac artery and internal iliac vein, right? So, sorry, external iliac vein. So that's why we are doing the operation, like surgery, and we are having some kind of problem here, right? So that person will have aspermia, no sperm at all going through the urethra to come out, and that's why they won't have the child, right? Because like in the in our vas deferens, we need to, like, sperms are moving, right? Like ready sperms, and after that, like here in the accessory glands, they are getting some kind of, let's say, fluid to activate them. Okay, so we are getting some kind of structures, the spermatozoas ready already, and they are going through this canal. Okay, so if we won't have, we are having aspermia, meaning that we won't have a child. The duct descends medially on the pelvical wall deep to the perineum and crosses the ureter posterior to the bladder. It continues inferior-medially along the base of the bladder anterior to the rectum, almost to the midline, where it's joined by the duct of the seminal vesicle to form an ejaculatory duct. And this is really important. As you see here, we are having like seminal vesicles, right? And in like the final part where the vas deferens should enter the, let's say, ureter, it is having some kind of ampulla, like the bigger outpouching, the ampulla, right? And next to the ampulla, we're having opening of the seminal vesicle, and together, vas deferens and seminal vesicle is creating our ejaculatory duct, and from the ejaculatory duct, they are becoming the part of our urethra. Okay? Questions? Okay, so vas deferens, right, is just a tube, but at some point, where should it enter to the next to the bladder, let's say, it is becoming a bit bigger. Have you seen ever the catheter? So it has some kind of ampulla part, right? It is like the tube, and at some point it is like a bit like bigger. So that's the ampulla. It will have like same structure there. Next to the ampulla, we're having seminal vesicle located. And seminal vesicle is another accessory gland that provides like the fluid to the sperms that came from the vas deferens. They somehow should combine that the sperm will be swimming in that fluid, right? So they are like seminal vesicles duct and vas deferens combining together in one duct. It is called ejaculatory duct, and with the ejaculatory duct, they are entering the urethra. Clear? No? They will go together. Do you have any other photos there? They are together forming the ejaculatory duct, and they are going into the urethra together. Okay. Now how they are going to urethra, right? You might say that around the urethra we're having prostate, right? So they are just penetrating the prostate gland here, and through the prostate gland they are entering the prostate part of the urethra. Okay? Yeah. Now let's have a break and then continue with the seminal vesicle. Okay, let's continue. So, now we're having two types of seminal vesicles, right? Two on both sides. Not two types, one type, but on both sides. So each seminal vesicle is an accessory gland of the male reproductive system that develops as a blind-ended tubular outgrowth from the duct deferens. The tube is covered with numerous pocket-like outgrowings and is encapsulated by connective tissue to form an elongate structure situated between the bladder and the rectum. The gland is immediately lateral to and follows the course of the duct deferens at the base of the bladder, as you see on this photo already. So again, the seminal vesicle is creating the ejaculated duct that it is then connected to the vas deferens is ejaculated duct, and both together are going into the urethra, prostatic part of the urethra. Secretions from the seminal vesicle contribute like the volume of the semen, so volume of ejaculate stuff, so that's the semen. And thus, from where it is created from vas deferens stuff, spermatozoas plus the seminal vesicles fluid, like together. Okay? Now, questions regarding this? No. Okay. Let's continue with the prostate. Prostate is like one of the most well-known organs in the male anatomy, and in Georgia it's a tradition that like if the male is having like benign prostatic hyperplasia, they are telling that he is having the prostate. Yes, but officially by anatomy, everyone is having the prostate gland, and whenever we're having some kind of benign hyperplasia, so we're having hyperplastic cells, so volume of the prostate gland is rising. That's benign hyperplasia. Ekiltwisabiyani prostatis hyperplasia. In Georgian, it will be for Georgian students, but not just like the prostate, because all males are having the prostate. Okay. Yeah, it's not like yeah. Appendicitis is different, and like the organ outpouching is different, so wrong names are called sometimes. Even with the cellulitis, whatever the fat tissue what we're having around the muscles, it's not cellulitis. Cellulitis is an infection of the fat tissue, and it has like abnormal pain and like really tough. It is infection caused by bacteria, but like in Georgia we're calling it like cellulitis. Oh, I'm having the cellulitis, and that's not correct. Even in like the sore throat, what in Georgian it is called angina. In English it's angina pectoris, like the heart problem, right? So the names are a bit changing there, and we're calling some stuff differently. So just in your country, if someone is calling, oh, I'm having a prostate, he's meaning that like benign prostatic hyperplasia, not the organ prostate, that he's having that also. So what's prostate? Prostate is an unipaired accessory structure of the male reproductive system that surrounds the urethra in the pelvic cavity. It lies immediately inferior to the bladder, posterior to the pubic symphysis, and anterior to the rectum. Okay? So this is the location of the prostate. We already discussed it 20 times. Prostate is shaped like an inverted rounded cone with a large base, which is continuous above the neck of the bladder, and a narrow apex, which rests below on the pelvic floor. The inferior lateral surface of the prostate are in contact with the elevator ani muscles that together cradle the prostate between them. So it is some kind in between of two structures, right? And it is squeezed, let's say. So like prostate is giving us some secretions. It has function, right? It's not just located there. Secretions from the prostate, together with secretions from the seminal vesicle, contribute the formation of the semen during the ejaculation. So now we can gather that Vas deferens gave us the sperm, like the seminal vesicle gave us like the fluid. Prostate is also giving us some fluid, and together everyone is giving us the ejaculation fluid, right? The ejaculatory ducts pass almost vertically in the anterior inferior direction through the posterior aspect of the prostate to open into the prostatic urethra, right? So everyone is opening in the prostatic urethra. What is the prostatic urethra? Why I'm not calling the urethra, but I'm calling it prostatic urethra? Because just is located like in the middle of the prostate gland, and it's the prostatic part, okay? Okay, and other structures. Do you have any questions regarding the prostate? No? Just like in this anatomy section, let's say like that, I'm giving you overview of the prostate gland. I'm not talking about the central zone, peripheral zone, and zones like that. We will combine this with the physiology. So after the course with the anatomy and physiology, you will get the anatomy more information, and with the physiology also. And plus we will do some kind of histology also, because I need it for the physiology, okay? And microscopes and stuff like that, how you will see in the histology lecture. But like cells, what I need, I will retell myself, okay? So, another structure that we're having, it's like our bulbo-urethral glands. And in the females, we're also having bulbo-urethral glands. And what they are doing, they are located on each side of the small, they are like located on both sides of the urethra. They are pear-shaped, small mucous glands located in the deep perineal pouch. They are lateral to the membranous part of the urethra and occur among the fibers of external urethral sphincter. The duct from each gland passes inferior-medially through the perineal membrane to open into the bulb of the sponge urethra at the roof of the penis. Do you remember what was the sponge urethra? What? So can you tell me where it is like the sponge urethra? Here is like prostatic urethra. Then comes here, here, where? Here. The bulbo-urethral glands are located here, so it will be the sponge urethra, right? Logically using. After the prostate, then comes like sponge urethra. So the bulbo-urethral glands are located here. Yes, they are opening into the sponge urethra. So next to the bulbo-urethral glands, we will have the sponge urethra, logically, right? It will be here. Spongy part, it's also medial part. Like there is like no idea of the medial urethra. No. We are having prostatic, spongy. So this is like prostatic part where the prostate gland is located. Okay, I got what you are saying, and I got what you have studied already. Previous quiz, urethra parts, anatomy. So yeah, I will show the photos regarding that. Let me finish this one and I will go back, okay? So it is opening in our spongy urethra. It is opening into the spongy urethra. Together with the small glands positioned along the length of the sponge urethra, the bulbo-urethral glands contribute to the lubrication of the urethra and the pre-ejaculatory emission from the penis. So we are having like in physiology like pre-ejaculatory material and also ejaculatory material, right? So pre-ejaculatory, what they are saying, it is like this mucous part, and after that comes the ejaculation. However, there is an idea that in the pre-ejaculatory fluid there is no sperm. However, there might be also sperm, because there is not some kind of like barrier that, oh, we are sending the pre-ejaculatory material and there should not be the sperm. No, it is like all combined together. So yes, from pre-ejaculatory material you can get pregnant also, because there might be the sperm. Okay, here we're starting the urethra. No. Urethra begins at the base of the bladder and extends till the opening of the opening in the perineum. The path is slightly different than the female's one. So, in males, we're having the urethra a bit longer because they're having the penis and it's longer way. So it's around 20 centimeters and it is bending twice along the course, and as you see here, we are having twicely, like one and two, twice curvature, let's say. So beginning at the base of the bladder and then passing inferiorly through the prostate, it passes through the deep perineal pouch and perineal membrane and immediately enters the root of the penis. As the urethra exits the deep perineal pouch, it bends towards the course anteriorly in the root of the penis. When the penis is flaccid, the urethra makes another bend, this time inferiorly, when pressing from the root of the body of the penis. During the erection, the bend between the root and the body of the penis, it won't occur, right? So, meaning because it is like the erectile position. So, we are having pre-prostatic, we are having prostatic, membranous and spongy part. Starting with the pre-prostatic part. Pre-prostatic part, it is like about 1 centimeter above the prostate part. It is extending from the base of the bladder to the prostate and is associated with the circular smooth muscles, fibers. We're calling it internal urethral sphincter. I guess we already talked regarding that. Contraction of this sphincter prevents like retrograde movement of the semen into the bladder during the ejaculation. Otherwise, we will have some semen in the bladder, right? Then we're having the prostatic part. It's around 3 to 4 centimeter long, and around it we're having our prostate located, and it is located in the longitudinal midline of the prostate. It has some kind of depressions there, and we're calling it urethral sinuses. And ducts mostly are opening in this prostatic part. So as you see here, we're having pre-prostatic part, we're having prostatic part, then we're having membranous part, and then we're having the spongy part. And as you see, the spongy part is starting from here until the end, okay? Not midline, what you were saying, it's not midline, but it is membranous part, which is like really small amount between the spongy part of urethra and between the prostatic part, but there we don't have any kind of openings at all, okay? Then we're having prostatic part and pre-prostatic part. So where all the structures are opening? Here, that's correct. So I've told you that we're having urethral sinus, right? So if you will see, sinus is like more like the diameter is a bit bigger there. And we're having like urethral crest. We're having some kind of, like as you see here, dots. It's our like the openings of the glandular epithelium of the prostate. And also we're having openings of the ejaculatory ducts. Also, as you see here, openings of the ducts of the glandular tissue, these ones, are for prostate, and the prostate is opening there. Okay, midway along the length of the urethral crest, and this was urethral crest here, like the middle part. It is enlarged and giving us like seminal colliculus. In men, the seminal colliculus is used to determine the position of the prostate gland during the transurethral transaction of the prostate gland. What's transurethral transaction of the prostate gland? Because we will use that a lot in our questions regarding the prostate gland. Like the name implies itself. Transurethral transection of prostate. guys think? Through the urethra and going up to the prostate urethra, and from there we are transectioning like circularly our prostate gland. Okay, so around me there is a ball, right? I'm the urethra, and around me there is a ball, right? And it's really tight, that the urethra, like for me it's really tight, right? And I can't move the urine in me. So we are going from the penis through the urethra, and we are circularly around the prostate, taking the central part, meaning that we are giving more space for urethra. That's what this procedure is doing, okay? Because I will be using this word a lot in the quizzes, whenever we will have the questions regarding that, okay? Yeah, in the prostatic part. But not of the urethra, but of the prostate. Yeah, the central region, right? Can you see? This is okay. Can you see? This is our urethra. Around it, we are having the prostate, right? The prostate should be like this, is 3 spaces. It should be like that. Yeah, but in some cases, whenever we're having benign hyperplasia or infiltration, like cancer, these structures will become like really tough around the urethra, like this. Meaning that the urine cannot go that, so the patient cannot urinate, right? So, we are going from the penis to the urethra, from here, and removing like these internal parts. So meaning that diameter will become bigger. So from inside we are like twisting around and making the hole bigger, okay? Like for example, whenever you are digging a hole, right? It is a small one, and then you are starting like around, going like in circular position and making the hole bigger. You are doing the same, and this is called transurethral transection of the prostate. What? Which seminal colliculus, it is like just the elevation in the urethra. It's not like the part of the prostate at all. If you will take the lumen of the urethra, there will be some kind of like mini mountain there, and that's that. Just it's called seminal colliculus. Like, see, this is like the inner part of our urethra, and there is some kind of outpouching, right? This structure, and this can be called like the seminal colliculus. See, it's really easy, just structure, not really important in our case, unless you want to become the urologist. So, small blind-ended pouch to the prostatic urticle through the thought to be the homologous of the ureter of the woman, opens into the central of the seminal colliculus. Here, the huge dots that you see, this one, right? On each side of the prostatic urticle, there is a small openings of the ejaculatory ducts of the male reproductive system. Therefore, the connection between the urinary and reproductive duct is the same, and it is happening in the prostatic urethra, okay? Now let's continue with the membranous part. So membranous part of the urethra is a narrow pass through the deep perineal pouch. During this transits through the this pouch, the urethra in both men and women is surrounded by the skeletal muscles of the external ureter sphincter. And as you see here, we're having external ureteral orifice. Then we're having navicular fossa. And then we're having like the structure of the membranous parts. Next, let's discuss spongiuretra. Spongiuretra is surrounded by erectile tissue. It is corpus spongiosum of the penis. It is enlarged to form a bulb at the base of the penis, and again at the end of the penis to form the navicular fossa, whatever we talked. So membranous part is just this small part, and after that like the sponge is coming, and the sponge is having like the opening in the external part. Yeah, whatever you said, like, yes, but I misheard that, I guess. Okay, you said, wait, if you said here, then it's correct. If you said here, then it's incorrect. Yes, spongiuretra is this part. Yes, membranous is this part. What you're calling middle? This, you are calling this structure middle? Okay, then it's correct. No, I thought that you are calling the middle part, you know what part? Like, by the name. You know, it's like the penis anatomy, but like the biuretral middle part. Okay. Okay, you are talking by the penis anatomy, that here it is the middle part, then it's correct. But if you are talking by urethral anatomy, then it's incorrect. Okay. Okay. So we are opening to the external environment, that it will be like the navicular fossa. So two bulbourethral glands in the deep perineal pouch are the part of the male reproductive system. They open into our spongiuretra. The external uretral orifice is the sagittal slit at the end of the penis. We already discussed this photo so many times, so one more time. We're having pre-prostatic, prostatic, we're having membranous, then spongy, and spongy is opening to the outside. We're having internal sphincter in pre-prostatic part, external sphincter in the spongy part. In the prostatic part of the urethra, all the seminal vesicles and all the fluid is gathering around with the urine, and there is happening the mixing, and that's it. Questions for the male anatomy? No questions? Are you sure regarding that? Yes, you are having the question. They're just giving us the nucleus. Where they're located. So do you see this structure? This is this round structure. This is our bulbourethral gland. Now another photo. Here, yeah. Like this small structure. Can you see it here? This is our bulbourethral gland with its duct. You are talking about like the beginning where the bulbourethral gland is joining. It's the spongiuretral's first part. It is like bulbourethral part. Yes. 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 That's why it is called like that. Okay. More questions, guys? No more questions? going through these openings, and they are removing like part of these. Yeah, so because like it's muscular tube, you don't wish to ruin that, right? So they are just removing these parts. Okay. Question? More questions? No more questions. Going to continue with the females. Or at least start the female one more time because it was far, like 3 weeks ago. Regard about what? Okay, that's the anatomy. So let me wait a minute, guys. I can't give you cases right now because we haven't studied some physiology parts for that, and they are combined with the structures, and I don't want to solve my questions yet. So, joke, guys. So, let's say like that. For example, when what can I ask regarding that? Okay, regarding the prostate glands, the questions might be actually like blocking of the urethra and why it is locked, and the clinical case regarding that the sperm is not coming out. Regarding the deep inguinal canal, there should be regarding the herniation because we are having like some kind of aponeurosis coming down and we're having the herniation. Let me check what's another questions that we didn't know. Oh, regarding the female, I won't tell you right now. Regarding the epididymis and structures like epididymis and ducts, we will talk about like the spermatic cells, how they are coming in the physiology, and then there will be anatomy combined questions. So that's why I'm telling physiology, anatomy, and histology are combined in this subject together. So that's why. Yeah, today no questions because otherwise I will give you the quiz questions and I don't want to do that yet. So that's why no questions for today. Now, female anatomy. So I guess with that, can you remind me what we have done? What? Yeah, I know that we use different PowerPoint, but what we have done? Can you remind urethra? We have done like the vagina. And what was left? No. What's from female anatomy we have done, if you remember? None. You don't remember at all. Okay, we're starting the female anatomy from the beginning. So, outside. Let's start from outside and go inside, right? We will combine two presentations, and the second presentation will be uploaded on your drive. So the reproductive system of the woman contains like pelvic cavity, perineum, and also like sometimes the abdomen part, because when we're having the pregnancy, the uterine cavity is going up, right? So to see 3D anatomy of our female tracts, we're having these kind of structures. We're having the uterus, uterine tubes, ovaries, cervix, vagina, clitoris, labia minors and labia majors and labia minors. Together, like this is all structures, how they are located. We will come to this. And if you will see from this side, how like normally what we are seeing during the checking of the female gynecology, we are seeing here what? The shaft and like length of the clitoris. Like clitoris is not just one micro penis, let's say, but it is the whole structure around through the minor labias. It has like the legs, glans and shafts and glans. It is sometimes said that it is part of the penis, so first it was created the penis, and then it was recreated as a clitoris. So it has like the same anatomy as the penis also. It has like opening of the urethra and opening of the vagina. Then we're having the perineal area, and we're having the anus. So what it is, mon veneris. It's a pad overlying the symphysis pubis. So this structure here, the bridge between two alas of the pubic bone, it is like the symphysis pubis. This is our mon veneris, where we're having like the skin, hairs, and some kind of fats. And clitoris, it's another main structure that creates our vulva. It is our clitoris, and it is an erectile cavernous structure below the symphysis pubis, and it is formed by small glands and two corpora cavernosum. So, well, whenever there is coming the erection, let's say like that, we're having the flow of the blood, and it is called like through the this cavernous, like, yeah. We are overlying the skin. We're having the minor labias and the major labias. And what are the minor labias? They are two thin folds, modified skin, situated medially to the major labia. And what are the major labias? There are outer two skin folds raised by the fat, and which is creating our mons pubis. So mons pubis is this part right here, and it created our major labias, and beneath the major labias we're having the minor labias. So outer skin, it is covered like with the fat, with the skin, and with the fat, of course. And there are some sebaceous glands also. The difference between the minor and major labias is that it doesn't have, minor doesn't have any kind of hair or any kind of fat. It's just the skin. Moreover, it would be correct to say it is the mucous membrane. However, the labia majora, it is like the skin covered. So in these structures, what we're seeing mon pubis, that it is created our labia majoras, right? Beneath the labia majoras, we're having the labia minors, that it is ending on the glands of the clitoris here. Like this is ending on the glands of the clitoris. Also, they created our urethral opening, vaginal opening, and down there we're having like the opening of the parietal glands, which is like opening in the vagina. We will talk about that. So, clear this part, guys. Okay. So, This is another photo how everything is located. So as you see, these are like the major labias are not visible at all, and we're having the labia minores located, which are created some kind of wings, and they created the hood of the clitoris, and where our clitoris glands, clitoris is located with its own shaft. Here is the shaft, and there it is clitoris. Penis that we're having urethral opening, and we're having the vagina, right? So what's vagina? Which is a round tube which has like external opening, right? And vagina is closed by the hymen. What's hymen, right? It's a membranous situated 2 centimeters from the vestibule that demarcates the external surface, external environment from the internal genital organs and partially close the vaginal orifice. That's the key point, partially close the vaginal orifice. Meaning that there's like in different cultures, everything varies. They said that like the hymen should fully cover the vagina. It's not like that. It partially covers the vagina because when there is menstruation cycle going on, from where it is living? It is living from the vagina, right? So we are having different variations of the hymen. So we are seeing, like, we'll go back to that slide, we are seeing different types of hymens, right? So this is like normal, like in the beginning, but virgin ladies hymen. As you see, it is circular. However, it is like most common form whatever we're having. However, we can have all the other variations of the hymens, and they are also normal, and this means they might be also the virgins. So, and they are the virgins. We are having B perforated. These are that like between the hole we're having this straight line like the mucous membrane. So it is called like the B perforate. We're having imperforate hymen. And here comes our problem because like the menstrual cycle is not coming out. So we're having some kind of problem, and we're going to the gynecologist in this case. And it is like visible around age of 16 or 17 when the menstrual cycle that should have been started at the age of 13 should have started, but it's not starting. So either there is hormonal problem or there is some kind of hymen problem, right? So in this case, if it is hymen problem, we're doing the surgery and we are cutting the hymen surgically. This is the deflorated vagina, let's say, and you see the difference of the hymen. It's like the size. However, we can't even say that it can be deflorated because we don't know if like it's official like normal size or if it was deflorated, but normally the size matters in this case. And yeah, and we're also having like cribriform plate 1, and it also needs a bit defloration in this case also. Okay. No, menstrual cycle has started, but it's not coming out. So there is no bleeding. The clotting, they're happening, the clotting, and it's inside the vagina, and at some point we're having like lots of problems like there. It is. After like 40 years, if you won't get that there is no blood coming out. But you know, in nature, like impermeable hymens are, let's say, with other diseases also. So you are getting like some other, let's say, problems, you know, with that. So it is like the secondary cause of the amenorrhea. Amenorrhea is no menstrual cycle at all. So this is like secondary cause, and always whenever you are saying that you are not having the menstrual cycle, the doctor is sending you to the gynecologist to check if your hymen is okay or not. More questions? Yeah. I can't hear you. She won't knew until like 13 years old, when her mom will say that you should have cycling or not having cycle, meaning we're going to the doctors, right? She won't start menstruating because it's like just door is closed. If she will start menstruate, the blood will clot and will stay in the vagina clotted. Yes, it will be clotted, yeah. You are doing then surgery and that's yes. Inside the minor labias somehow. Yeah, legs are open. In the butterfly position, yes, we're having the butterfly position. Then it depends on which way. The fact is that like butterfly position, it's not like when you are taking the child, you are not taking straight ahead like that, right? And you are not, let's say, washing in like in the minor labias. You are not having in that position child because it should be like up, really up. Yeah. No. That's the fact. What I'm telling is that when the lady is like taking the butterfly position, like position, the legs are at particular angle that it is easier for the doctor to put the speculum. Speculum it's in Georgian will be sarkerochatas. Like the speculum, right? So that speculum is entering straight ahead, right? So you don't need like to do this kind of stuff to open the doors and like you are not doing that. You are just going through inside, right? And it's in special location how it is there. It won't be visible because it's deep inside. Okay? Another question you might have, yes. Or else please. Circumcision surgery for females. What purpose? Because not to have the pleasure. Yes, like circumcision surgery is like removing the clitoris. It's not for like any kind of anatomic conditions or no. It's for orgasm. More questions? Surgeries. So, just one moment. Guys, like every group is having one question. Why you don't have this question? I was wondering. Can gynecologists check if the person had like yes regarding the virgin? If not, yes, but when they had like the sexual intercourse or whenever they had this, can we check that? It's not visible. It's not visible during the like when the deflorated patient is coming, we can't say if it is having, if that person had like the sexual intercourse before day or the day after tomorrow. Like we can check it by differently, not by our anatomy, but we can check by the semen if there is like in the vagina or not. That's what I'm telling you. We can't say by anatomy, girls, please. We're saying we can't say by we can't say by anatomy, but we can say by existence of the semen there. So whenever we're doing some it's called bimanual examination, we ask them not to have some kind of sexual intercourse for 3-4 days before. We can find out if it is like but like, you know, it is, that's why I told you like the virgin whole, let's say, and the fluoridated, it can be random sizes, right? It's not said that like 3 centimeter like diameter, it is virgin. It's not said like that, so they can't find it out really officially. But like, yeah, so that's why. Okay, so next several slides and we're done with that, so sorry. Okay. Now another openings that we're having on our vulva is our bartonal glands. We're calling it greater vestibule glands, vestibules, vestibular bulbs, external urethral meatus, and Skinnerland's ducts. So bartonal glands, they are bilaterally located. It is their raised nose glands. They secrete mucus during the sexual excitement. They are situated in the deep labia majora at the junction of the posterior third of the labia majora. And its duct has like 2 centimeters and they are opening out to the external environment between the hymen and the labia's ending. And we are having like their bartonal cysts sometimes when there is an infection. It's really painful and there is always some kind of ball when the patient is coming at the end of the labia minora. And it's really common situation, to be honest. Vestibule, the area between the inner aspect of the labia minora and the fourchette. The structures that open in the vestibule, it is like urethra, bartonal glands duct, and the vagina. So from the clitoris till perineum, this is what our vestibule, and there we're having the openings of the urethra, bartonal glands, and vagina. Another structure that it is important is our vestibule bulbs, and they are the ones that have the erectile tissue and lies on the both side of the labias. We're having external urethral meatus. It's a triangular slit in the anterior part of the vestibule below the clitoris, in which the urethra opens, and we're having these Skinnerland's ducts, and it's 2 blindly ending para-urethral tubules that they are giving the mucus to urethra itself. Okay? Okay, so let's finish with blood supply. So we're having the arterial and venous drainage, right? Arterial supplies internal pudental artery, the terminal branch of the anterior division of the internal iliac artery that end as the dorsal artery of the clitoris. Branches from femoral artery also supplying the arterial part. And we're having the superficial and deep external pudental arteries. Regarding the venous drainage, the vein drainage from the vulva form a venous plexus from which veins are going, like by the names are the same with the arteries and with the names, and they are mostly draining the clitoris, join the vaginal visceral venous plexus. We will see the photos in a minute. And lymphatics from the skin and appendages to the superficial inguinal lymph nodes to deep inguinal and femoral lymph nodes, of which the lymph node we are having like clockwise drains to the clitoris directly, superficial group, we are having like external iliac, common iliac, para, aortic lymph nodes that are draining that area. And regarding the nerve supply, we are having pudendal nerve. On the pudendal nerve, we might have a good question regarding the anesthesia, because it is like one that we're using for anesthesia. And sensory nerves, it is like ilioinguinal nerve, genitopharyngeal, genitofemoral nerve, that's like supplying the thigh and the vaginal area, like the vulva and all this stuff. So we need blood supply of fluid. There is no blood at all. So this is exactly what I talked right now. Yeah. So as you see here, we're having like deep artery of clitoris that will become soon the femoral artery, and internal pudendal artery. So this is like for all the branches, whatever we spoke. So we're having here dorsal artery of the glans and prepuce, vestibular and vulvar and vaginal arteries. Okay, do you have any kind of questions? No? Then thank you. Have a nice evening.